Have you ever wondered if that vitamin you're taking is actually doing anything for your breathing? Or are you just, making some really expensive pee? Today, we're going to unpack that super complex and, let's be honest, often confusing relationship between nutritional supplements and our respiratory health. We're going to use science to cut right through the noise. So, let's dive in. For so many of us, that feeling of a connection between what we put in our body and how well we can breathe, it feels real. But it's usually just buried in a whole lot of guesswork and maybe some coincidences. We've all been there.
Yeah, does this sound familiar? You start something new, you feel a little bit better, but then you're left wondering, wait, was that the supplement or was it just a good week? That uncertainty is so common. And this one really hits on the core problem, doesn't it? When you're taking a few different things, trying to pinpoint what's actually moving the needle for your health can feel completely impossible. It's just a frustrating and frankly expensive guessing game. So that's really our central question for this whole explainer. How do we get from all those anecdotes and all that confusion to a real personalized understanding? How do we find that one clear signal that tells us what's truly working for our body? Okay, so let's start by digging into the science. Because this connection, it isn't just a bunch of speculation. It's actually grounded in real documented biological processes. Your body has these specific systems that supplements can directly influence. Now, what's really fascinating is how it all breaks down into 5 key pathways. So think of it like this. First, you've got antioxidant defense. That's like your body's rust-proofing system, which things like vitamin C help to run. Second is the anti-inflammatory pathway, kind of like an internal fire department that's fueled by omega-3s and vitamin D. Third, you have bronchodilation, the airway relaxation crew, where magnesium is a huge player. Fourth is mucus clearance, your own personal decongestion service that relies on compounds like NAC. And finally, there's immune regulation, which acts as your immune system balancer, and it gets support from vitamin D and zinc. So, with those pathways in mind, let's meet some of the most researched supplements that pop up in the studies and see exactly how they plug into these systems. And this table just illustrates those connections perfectly. I mean, look at vitamin D, pulling double duty in both the anti-inflammatory and immune pathways. Research actually shows it can reduce asthma flare-ups for people who are deficient. Then you have magnesium, which directly helps with bronchodilation by relaxing those airway muscles. NAC is a total star player for both mucus clearance and antioxidant defense. And omega-3s and quercetin, they're basically powerhouses for fighting inflammation. The crucial point here is these aren't random. They have very specific jobs to do. So we know the pathways, we know the key players. Seems pretty simple, right? Well, not exactly. It turns out there are these hidden complexities that really determine whether any of these supplements will actually work for you. There are three crucial factors that make all the difference. Let's break them down. The first complexity is synergy, and that's just a fancy way of saying some supplements don't work in isolation. They work way better together. A perfect example is vitamin C and vitamin E. Vitamin C actually helps regenerate vitamin E after it's been used up fighting off stress. So together, their antioxidant power is just way greater than if you took one or the other. What works best might be a combination, not just a single pill. Okay, second is formulation, and this one is a really big deal. Not all supplements are created equal, even if the label looks exactly the same. Just look at magnesium. Magnesium oxide is cheap, sure, but it's not absorbed well and can, cause some digestive issues. Magnesium glycinate, on the other hand, is super absorbable and much gentler on the stomach. Same mineral, totally different results in your body. The form matters a lot. And the third complexity is timing. When you take a supplement, it can be just as important as what you take. For instance, fat-soluble vitamins like D, they need to be taken with a meal that has some fat to be absorbed right. Others might interact with medications, so you have to space them out. You can even time certain supplements to be most effective, like taking magnesium in the evening to help relax your airways while you sleep. So, let's get to the single most important factor that really ties all of this together: you. Your unique biology is the ultimate variable in this entire equation. A supplement's effect depends completely on your personal context. I mean, are you deficient in the first place? Vitamin D is a total game changer if your levels are low, but it does very little if they're already fine. Your genetics, the specific type of respiratory condition you have, your gut health, even the environment you live in, all of it creates a unique personal blueprint that determines your needs and how you're going to respond. So, with all this complexity and personalization, how in the world can we figure out what works?
Well, the answer isn't some one-size-fits-all recommendation. It's about shifting our whole perspective to finding our own personal pattern.
So here's the crucial point. The path forward is through observation. It all starts with consistently tracking what you take, the specific supplement, the dose, the formulation, the timing. And at the exact same time, you monitor your respiratory symptoms as objectively as you can. Over time, you can start to look for correlations. You'll see your own patterns begin to emerge from all that noise. You basically become your own health detective.
And really, that's the ultimate takeaway here. The scientific evidence gives us a map of possibilities, but it doesn't show us the specific path for our own individual journey. By understanding the science and embracing the complexity, we can start to uncover the connections that matter most to our own health. So the real question isn't just which supplement works, but rather, what unique patterns are just waiting to be discovered in your own health story?